How much of a difference will wearing eye protection compared to a face mask or a face shield?
So the question of eye protection is an interesting one. We know that the primary route of entry for this virus is through the nose and the mouth. So think about the virus coming in through the nose and the mouth as if it was taking the front door into the lungs. But it can also get into your lungs through the eyes, and that's because the eyes are intimately connected to the nose and mouth through a system called the nasolacrimal system. So if it gets into your eyes, it can then get into your nose and mouth and then get into your lungs. So think of that as sort of the back door into the lungs for the virus. So definitely more common to contract the virus through the nose and the mouth, but it can happen that you can contract the virus through the eyes as well.
And I know that was a recommendation from Dr. Fauci, but why weren't we told about wearing eye protection before, possibly?
There's a lot of reasons why eye protection was not really focused on earlier in the pandemic. The first is that we're still learning about the relationship of the virus and how it can enter through the eyes. Now, we know that in hospitalized patients, according to the New England Journal of Medicine, less than 1%, and according to some other studies, 1 to 3% of patients have conjunctival or eye involvement with the virus. So it's really a small minority of patients that are hospitalized that are having eye involvement with the virus. The second reason is because it's not considered the primary portal of entry as compared to the nose and the mouth. And then the final reason is because we're just starting to learn about how eye protection can be implemented. And if we give people too many things to do, we tell them to wear a mask and wear eye protection, they're much less likely to do all of those things together. So it really makes much more sense to tell them to focus on the mask, which is the most likely to prevent the virus, and really think about eye protection as a secondary priority.
What kind of protection should we be wearing just on a daily basis, maybe running errands or going to the grocery store?
So the main thing with the way the virus enters through the eyes, there's really two ways that it does. The first is that you touch something, a surface that's contaminated, and you rub your eyes, and you've actually inoculated the virus into your eyes. The second and much more uncommon way that people have described is through tiny aerosols or droplets of virus particles that may be lingering in the air that then contact your conjunctiva directly and then get inoculated. So if people do wear eye protection, such as sunglasses or eyeglasses, they have to be exceedingly careful that they don't paradoxically increase the touching around the eyes with the sunglasses or the eyeglasses or rubbing the eyes, because that could potentially increase the risk of the virus getting inoculated, just like we say with the mask. But really, any type of eye protection that kind of protects the conjunctiva and the eyes all around could work. The highest level of protection would be offered from a face shield, which creates a seal all the way around the forehead, goes all the way to the sides of the face, and then goes down beyond the chin, because that protects all three portals of entry and definitely protects you from touching your eyes or inoculating anything into your eyes.
Any advice for myself who are contact lens wearers? I touch my eye all the time. Well, not all the time, but in the mornings and at night when I have to take out my contacts.
So contact lens wearing is tricky because in some ways contact lens wearing is a foreign substance inside your eye. Those who wear contact lenses can also have slightly variations in the colonization of bacteria in their eye, as well as the immune function of the eye. So I would say be exceedingly careful about washing your hands for that full 20 seconds before you touch your eyes. As a precaution, if you tend to touch your eyes during the day, you may want to think about wearing a face shield or a face mask, just so that it reminds you not to touch your eye, because you can expose yourself to risk that way. And as an alternative, you could just think about wearing glasses during the pandemic, because number one, they offer the eye protection, and number two, they make you less likely to touch the inside of your eye, which is really where the virus gets in from.
And advice for parents as well, maybe for their kids, they're hearing this kind of advice. What kind of protection, eye protection, or even just face masks or face shields, what would you recommend for younger children?
You know, face shields are a really great option for younger children for a number of reasons. Number one, it makes them less likely to touch their face because their eyes, their nose, and their mouth are covered, as compared to a mask where they're more likely to adjust it as a younger kid. Number two, because they're clear, they can actually see other people's faces and people can see their faces. So it allows their social development to also be unimpeded. And number three, they are more comfortable to wear for the younger children rather than the masks. And the studies are telling us that kids under the age of 10 may not spread the virus as efficiently as adults do. So face shields would actually be a really great alternative to face masks in these young children. Now, this is a caveat. Again, the face shield has to cover your face and all the way around. You have to make sure you clean it frequently so that you don't contaminate the outside surface of it as well.
And so thinking about cleaning, how often should we be, I see so many of the reusable masks that people knit. How often should we be cleaning those?
So masks should really be cleaned after every use, ideally, but at least once a day. So what I do when I'm going out grocery shopping is I have a mask, a cloth mask that I use for Mondays, one for Tuesdays, one for Wednesdays, and then wash them all at the end of the week. So reusing masks can certainly increase your risk of infection, not just with coronavirus, but with other viruses as well, which is going to become more relevant when flu season starts to come in a few weeks as we start to get into fall. So we have to think about using these masks, the face shields, anything that we're using to protect ourselves in the most hygienic way, and also how we store them. And this is particularly important for our kids as well, because kids tend to throw things around, not think as much about what's contacting what. So the CDC has recommended actually sending your child to school with a little plastic bag to store their mask in when they're, eating lunch or at times like that when they're not wearing the mask. So a study published in JAMA Ophthalmology a few weeks ago looked at 38 hospitalized patients from the Hubei province of China and looked to see what the connection between the eyes and the virus was. And what they found was that 32% of those patients had conjunctival involvement. So higher than that 1 to 3% that some of the other studies have found. They also found that 18% of the people that they tested had virus secretions in their tears and positive conjunctival swabs. So what this suggests is that the virus can invade through the conjunctiva and the eye, which was really an alarming finding for some scientists, because the eye tends to have heightened immune responses in some way, because if you think about it, it's constantly in contact with the external environment. But this is something to think about, because the way we first realized the connection between the eyes and the virus was through the Chinese ophthalmologist who, passed away from this virus. Was a young doctor who was contacting the eyes of his patients, and there's some speculation that he may have contracted the virus through tears. So in addition to avoiding respiratory droplets of others, you also want to be mindful of their tears or any kind of secretions from their eyes that you may come into contact with. So definitely don't share contacts with somebody else.
Okay.
So based on Dr. Fauci's comment on CNN last night, he did clarify his comment about eye protection in the setting of COVID-19. He is not suggesting universal eye protection for everybody at this time. However, I personally do recommend certain groups be wearing eye protection. So first is the high-risk group. So if you're one of those high-risk groups, the elderly, immunocompromised, or high risk from the virus, eye protection is recommended. The second is those that have a high risk of exposure. So if you're somebody who works closely with COVID patients or in a healthcare setting, your first line responder, eye protection would be a good idea. And then finally, I would say that eye protection has very minimal risk, but it has a lot of benefit. So if you're somebody who's risk averse and wants to wear the eye protection, I would strongly encourage you to do that.
That's great. Thank you so much.
Okay, thank you.